Hello, my name is Kelly Schmidt, and today we'll be going over Chapter 16 in D439 Nursing Assessment. The nursing process is a series of steps that nurses take to assess patients, plan for and provide individualized care, and evaluate the patient's response. It is considered the framework upon which all nursing care is based. The American Nurses Association defines the standards of nursing practice and states that the nursing process as a critical thinking model demonstrates competency in nursing practice and forms the foundation for clinical decision making. As you can see, the nursing process utilizes 5 sequential steps: assessment, analysis, planning, implementation, and evaluation. Today's lesson will solely focus on assessment. Nurses must apply critical thinking throughout this process because we must gather key patient data, identify unique patient needs, create realistic SMART goals and individualized interventions, and evaluate the goal attainment. We also need to communicate and collaborate with other members of the healthcare team. We also need to make customized patient-centered plans of care and consider personal preferences, cultural influences, beliefs, and the values and the lifestyle of the patient. Each step of the nursing process is unique, but they are all interdependent. Each step requires information from the others to develop an effective plan of care. What is the purpose of the nursing process? It's to establish a standard of care where nurses assess patients and create plans of action to address individualized patient needs. The nursing process requires nurses to assess patients accurately, to organize data, and to analyze findings to provide a safe environment where we can provide safe, patient-centered care. And at any given time, nurses are required to think about several steps of the nursing process at one time to make sure all the clinical data is considered and to provide evidence-based patient care. The nursing process establishes plans to meet patients' needs. It guides nurses in the delivery of high-quality, evidence-based care. It protects nurses against potential legal problems. And it promotes a systemic approach to patient care that all members of the nursing team can follow. Some things that you want to ask yourself during the nursing process. Is the data collected thoroughly and accurate? Are outcomes specific and realistic and appropriate for the patient? Are any underlying factors contributing to the patient's response adequately addressed in this plan of care? And could any of our nursing interventions have a negative impact? Are the interventions safe? And do we need to make any revisions? There are 7 main characteristics of the nursing process. We must stay within the legal scope of practice. This might be the most essential characteristic of the nursing process. We must stay in the legal scope of the nursing process. Effective use of the nursing process requires the nurse to utilize nursing knowledge and skills to identify problems. We need to use our knowledge combined with critical thinking skills and the use of evidence-based practice nursing interventions. We need a well thought out planned approach to patient care. This care needs to be delivered efficiently and in order. The nursing process needs to be client-centered. Nurses need to understand the importance of client-centered nursing care. It supports patient autonomy, and it helps us to provide individualized care to that patient. We need goal-directed care. Achieving individualized goals will achieve desired patient outcomes. Goals are created through the collaborative efforts of not only the patient, but the nurses and other members of the healthcare team. We also need to prioritize. We need to focus on the most serious issue first. For example, breathing is a much more serious issue than pain. So we need to focus on the most serious issues first. Our approach also needs to be dynamic and cyclical, because this process could always be changing based on the patient's needs and circumstances impacting their needs and the environment in which it is applied. We also need to be dynamic and cyclical and remember that emotional, physical, social, and medical aspects will need to be addressed. The nursing process is 5 steps: assessment, diagnosis, planning, implementation, or evaluation. Could also be assessment, analysis, planning, implementation, and evaluation. I like to say ADPIE for short, ADPIE. And I happen to love pie, so it's pretty simple for me to remember. ADPIE. Today, we're only going to go over assessment. There will be an additional video for diagnosis, planning, implementation, and evaluation. Assessment is the first phase of the nursing process. In this phase, the nurse collects and organizes data. Data includes information about the patient and the family or any caregivers, the community that the patient lives in, and or their environment. It is very relevant to their health and well-being. In the assessment phase, think about it. The nurse gathers the patient information. Assessment, right? Assessment gathering. This information will be used to establish a plan of care. Remember, every other step of the nursing process builds upon the previous. Without a thorough assessment, the other steps of nursing care can be severely impacted or negatively impacting, resulting in an unfavorable outcome. Assessments performed correctly help reduce the risks to patient safety. Think about when you go into the doctor not feeling well. Assessment collects the data. Why are you here today? Can you tell me more about this? Can you describe the pain, right? Put yourself in the shoes of that patient. We may all have been a patient at once and gone through an assessment. It's really important, really important that the first thing you do while you're gathering information, which is used to guide and plan care, is that you establish communication. The patient is the nurse's main source of information. Therefore, it is essential to establish rapport as soon as possible. We also need to establish communication with the patient's family or caregivers when appropriate. Family members and friends often have insight to what's going on with the patient. It is also very important for us to listen to the patient support system to gather any information. The assessment phase is also where we establish trust. We need to conduct an interview, and when a patient feels comfortable, it makes it easier to get information. The patient interview is one of the main sources of information used to plan patient care. It's really important to lean in when someone's talking. It's important for eye contact, if culturally acceptable. It's important to not interrupt and to listen. We need to collect objective data, which is observable, like a vital sign or lab tests. Objective data can be your blood pressure or your temperature, your cholesterol level, and your height and your weight. Subjective data is information gathered from the patient, such as, my head is pounding. My muscles feel tense. My eye is itchy. Subjective data is information that we cannot see. What does the assessment phase involve? Well, we have to collect data. We collect the objective, remember the measurable data that we can see, height, weight, blood pressure, cholesterol level, and the subjective data. My eye is itchy. My head is pounding. And the most common methods for collecting this data are patient interview, a physical exam, and observation. We need to have communication and conversation with the patient. This is used to obtain information and identify any problems that the patient may be having or concerns. We are there to evaluate, provide support, and educate the patient and family members or caregivers. The nurse will also conduct a head-to-toe nursing assessment addressing each body system and noting any abnormalities, complaints, or concerns. We need to use all of our senses: sight, touch, smell, and hearing. The assessment phase is a critical component of the nursing process because information gathered in this phase is used to establish a foundation upon which all patient care moving forward is established. And please note, it is normal for patients to feel nervous when they're sick or when they're in an unfamiliar place like a hospital. That is why it is so important to establish trust and an environment that is conducive to patient comfort. And our assessment may be limited to factors such as environmental, physical, culture, safety, psychosocial, psychological. After collecting data, the nurse must organize and validate data and document about the patient's health status. Validation is the process of verifying data to see if it's factual and accurate. Nurses should not make assumptions or come to conclusions without accurate data to support. We also need to know the difference between inferences and cues. Cues are signals the patient uses to alert a nurse about a concern. Inferences are the nurse's conclusion or interpretation based on cues. For example, the patient may complain about a painful incision 2 days post-op, and the nurse may observe the incision is red and feels hot. These are cues. The nurse then makes the inference that the post-operative incision might be infected. If I come in and say to you, oh, this incision, it's so painful, it hurts. You do an assessment, you're going to start thinking to yourself, oof, okay, I'm thinking this is infected. I'm getting the feeling that this is infected based on the patient's cues. In the assessment phase, our mind is already spinning as to what might be wrong with the patient and what they might need. The wheel starts spinning. And we need to document. After data, you need to document. Thorough documentation is one of the best ways for everyone involved in patient care to be aware of changes, and it helps promote effective collaboration with other members of the team. In nursing school, I was always told, if you didn't document it, you didn't do it. If it's not documented, you didn't do it. And from a legal standpoint, if you are asked to verify patient care and there's no supporting documentation, there is no way to prove that that care occurred. And that could be very legal and ethical disaster. Document. All documentation should be done immediately. There are always barriers or challenges. Challenge number one, when gathering assessment data as the first step in the nursing process, is limited time. There are days as a student where you don't feel that there are enough hours to accomplish all the work that needs to be done. That may carry over in your role as a nurse when you're short-staffed or have several patients waiting for an assessment, and it can be overwhelming. So how can you fix this? It's important for nurses to perform thorough nursing assessments for all patients assigned to them, and we need to manage our time efficiently. We should recognize barriers that could impede the assessment phase and find ways to overcome them. There's always going to be interruptions. It's not uncommon. Some interruptions are necessary and some are not. But interruptions during patient care can delay care that results in error or omissions of data. How do we overcome that? Provide for privacy before you begin the assessment. Whether you're working in the emergency room, a doctor's office, or assessing a new patient admitted to your floor, hold the privacy curtain closed. Shut the door. Some facilities even use do not disturb or room in use signs to provide privacy for nurses and patients. Another barrier is inexperience. We all know the importance of a good nursing assessment, but newly graduated nurses are less experienced and may feel uneasy about performing a nursing assessment alone. The facility may also change documentation formats or implement new programs for charting, and it takes a while for you to get used to that. Change is hard. But what you can do is gather your basic equipment, gloves, thermometer, blood pressure cuff, stethoscope, pen light, watch, and always establish a sense of trust. You need to make sure you cover every body system. If you assess every body system and make notes about what is abnormal and normal, you will decrease the chances of omissions in documentation. Take your time, trust your instincts, and if you need help, ask. Another barrier. What if the patient is anxious? Patient anxiety can create a significant challenge for nurses during a patient assessment. Anxiety can hinder communication, making it difficult to gather necessary data. As you know, if anxiety is bad enough, it can show an increase in blood pressure. It could be misinterpreted as something more than just an anxious reaction. So before you begin an assessment on a patient, take the time to make your patient comfortable. You may not have the time for long conversation or get to know you, but you can be calm and friendly. Some questions make patients feel uncomfortable, especially a teenager. I have a teenager. It can be uncomfortable. Allow for adequate time for them to answer your questions without feeling rushed, and verify their understandings by asking you if they can explain what they discussed in their own words. And remember, everyone, including you, gets nervous. And when we're sick, it can be worse. Please make everything about the patient. Another challenge. If you're anxious, are you telling the truth? Are you embarrassed? There are times when patients are so anxious that they may be apprehensive about sharing personal information. Lack of information or omission of details might have a negative impact on the process of care that you're planning. So it's important for us to understand that a patient's apprehensiveness may be crucial. We need to remember that being sick and needing medical care can be frightening, not only to a teenager, but to a grown adult. We need to make sure that we are demonstrating that we are accepting no matter what they tell us. Be sure to tell your patient that they're there to help you. And that you are there to work with them. And that while you do your part, you're going to expect them to do theirs as well. Some frequently asked questions about assessment. Why is assessment the first step of the nursing process? Well, it lays the foundation upon which other nursing process steps build upon. The information gathered during the nursing assessment tells you a story about the patient's history, current complaints, medications, and any other pertinent information that may impact care planning. Without this thorough, proper patient assessment, it is impossible to develop a patient-specific care plan. Now that you think about it, we've all possibly sat through an assessment as a patient. How is the data for assessment obtained? We communicate with the patient, the spouse, and the caregivers. We read patients' records, we have nursing observations, and we collect measurable data such as vital signs. Subjective data is also collected. A few examples are why you here at the doctor, medication history, and any symptoms such as chills, aches, pains, itching, burning, etc. For example, when you go to the doctor and they say, what brings you to the doctor today? And you might say, I have had a pounding headache for 3 days. That's subjective data. Remember, objective data is any measurable information. Height, weight, vital signs, lab diagnostics. And remember, we collect this data through verbal conversation and nonverbal. A patient may be clutching or guarding his side, holding their head, nonverbal. What are the sources from where data is collected? The primary source is the patient, but other sources may include the family members, the caregivers, and any other members of the healthcare team. Data can also be collected from lab or diagnostic reports, the medical patient records, and the nurse observations. How do we know that the data that we collect is accurate? We can ask the patient additional questions. We can compare objective and subjective data to see if there are any discrepancies. We can recheck the data by repeating the assessment, and we can verify data with other members of the healthcare team. For example, if your patient has a blood pressure reading of 200 over 100, but has no history of hypertension, the nurse should retake this blood pressure to validate its accuracy. And if the nurse even feels that it's necessary, they might want to go get a new blood pressure cuff or ask someone else to verify accuracy. The primary methods used to collect data are observation, patient interviews, and head-to-toe assessments. And the tools we use: stethoscope, blood pressure cuff, thermometer, pulse oximetry, and scales. If you have any additional questions on assessment, we can go back. You can look at the information, Chapter 16. Reach out for help, questions, resources, etc. Also look for the adaptive quizzing within the course material as well. Thanks for taking the time to listen, and I'll speak with you soon. Have a good day.